I hate to say this, but it feels like 2020 all over again. Overflowing hospitals and thousands of patients with flu-like symptoms. China is facing a new health outbreak which looks a lot like the Wuhan virus or the COVID-19 virus, which was a global pandemic and led 7 million deaths worldwide.
The total number of cases worldwide of the coronavirus have topped 7 million as of Saturday, according to a tally by Reuters.
The HMPV, that is the human metapneumovirus, is massive. Beijing, Tianjin, Hebei, Shaanxi and Inner Mongolia, these 5 areas have reported the highest number of cases. A lot of photos and videos have emerged of people wearing masks in hospitals in China, and the local reporters says that these scenes are similar to that of the initial COVID pandemic. The exact figures aren't available for now, so it's difficult to know the exact severity of the situation. However, China has confirmed that the infection are on the rise, especially in the northern side.
China's Disease Control Center is saying that the northern regions of the country have particularly high case numbers and particularly high spread at the moment of HMPV.
Now, the HMPV or the human metapneumovirus is a respiratory virus that causes symptoms which is similar to that of the common cold or influenza. While the illness is typically mild, it can lead to severe complications such as pneumonia, particularly in children, the elderly, and those with weakened immune systems. The HMPV virus is an enveloped single-stranded RNA virus which was discovered about 20 years ago. In fact, serological studies have shown that it has existed for at least 60 years. Despite that, we still don't have a vaccine for HMPV. The infections of HMPV have been previously discovered in other countries, including the United Kingdom.
CNN's Max Foster reports it's an attempt to block a new variant of coronavirus in the UK, one that appears to be much more contagious.
Much like coronavirus, the HMPV virus can spread through one infected person to the other through coughing or sneezing or coming in contact with each other. Once HMPV enters your system, it can roughly take 3 to 6 days to show the symptoms. The symptoms include cough, fever, nasal congestion, and shortness of breath. In severe cases, the symptoms can worsen to bronchitis or pneumonia. The WHO has not yet flagged the situation as the global emergency, but the rise in cases makes the authorities to increase the monitoring systems. Now the question is, who is at most risk of getting infected? The virus can affect people of all ages, but young children, elderly, and people with weakened immune systems should pay extra attention. Can HMPV spread to other countries? Well, Hong Kong have already been reporting some cases of HMPV. Neighboring countries like Cambodia and Taiwan are keeping a close watch on the situation. In India, the officials said that there is no need for panic as HMPV is just a respiratory virus. Health officials in India assured the public that the country is ready to handle any rise in respiratory illnesses as there are strong monitoring systems in place and no unusual patterns have been observed locally. As a precautionary measure, the ICMR plans to enhance laboratory testing for HMPV and will monitor trends throughout the year. Now, the bigger question is that is the HMPV virus similar to COVID-19? Well, they both comes from a viral different families, but they do have a lot of similarities as well. Firstly, both the viruses target the respiratory systems, causing mild to severe infections. Secondly, they both causes same symptoms like cough, fever, sore throat, etc. Also, they both target the same age group like children and the elderly people. However, a key difference lies in the vaccine availability. While efficient vaccines were available for COVID-19, no such vaccine are available currently for HMPV. Lastly, I would say the HMPV is concerning, yet we must stay informed, follow the guidelines and trust the health experts. Let's stay hopeful, focus on our health and take care of ourselves and others.